Good afternoon, everyone. My name is Laura Morell, and I work in the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of the One Health Office, I'm pleased to welcome you to the monthly Zoonoses and One Health Updates call on February 3rd, 2021. Next slide, please. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, the CDC has no control over who participates. Therefore, please exercise discretion on sensitive content and material as confidentiality cannot be guaranteed. Today's webinar is being recorded. If you have any objections, you may disconnect now. Next slide, please. Today's presentations will address one or more of the following 5 objectives. Describe 2 key points from each presentation. Describe how a multi-sectoral One Health approach can be applied to the presentation topics. Identify an implication for animal and human health. Identify a One Health approach strategy for prevention, detection, or response to public health threats. And identify 2 new resources from CDC partners. Next slide. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of unlabeled products or products under investigational use. CDC, our planners, presenters, and their spouses and partners wish to disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. The Planning Committee reviewed content to ensure there is no bias. The presentations will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept commercial support for this activity. Next slide. Instructions for receiving free continuing education are available at cdc.gov/onehealth/zohu/continuing education. The course access code is OneHealth2021. To receive free CE for today's webcast, complete the evaluation at cdc.gov/TCE online by March 5th, 2021. And to receive free CE for the web on-demand video of today's webinar, complete the evaluation at cdc.gov/TCE online by March 6th, 2023. A captioned web on-demand video of today's webinar will be posted online at cdc.gov/onehealth/2021/February.html within 30 days. Next slide. Before we begin today's presentations, Dr. Casey Barton-Baravesh, Director of CDC's One Health Office, will share some news and updates. You can begin when you're ready.
Thanks, Laura, and hello, everyone. Thank you for joining us on today's ZOHU call. We really appreciate your help in spreading the word about the ZOHU call by sharing the website link with your colleagues from human, animal, plant, environment, and other relevant sectors. Before our presentations, I'd like to share a few One Health COVID-19 updates and highlights from today's ZOHU call email newsletter. If you're not yet subscribed, please use the link at the top of the main ZOHU call webpage so you can stay informed. CDC's response to the COVID-19 outbreak continues to evolve. Please check CDC's website for the latest guidance and resources, including information about keeping people as well as pets and other animals safe and healthy. The CDC One Health Federal Interagency COVID-19 Coordination Group, or OFIC, continues to bring together representatives from 20 key federal agencies for regular meetings to share news and updates and to collaborate on the One Health aspects of COVID-19, to develop joint guidance on the aspects of COVID-19 relevant to the health of people, animals, and the environment. And with animals, that covers companion animals, wildlife and zoo animals, and livestock and other production animals like mink. We also hold a monthly One Health Partners COVID-19 webinar to provide news, key updates, and guidance and resources for public health, animal health officials, veterinarians, pet owners, and others. Our next call is going to be on March 16th. You can email onehealth@cdc.gov to get more information on how to join that webinar. At this time, CDC is aware of 198 confirmed cases of SARS-CoV-2 infection in animals from 23 countries, including cases in pet dogs and cats. large cats and gorillas in zoos, a pet ferret, and a wild-caught mink captured around a U.S. mink farm that was confirmed with SARS-CoV-2. This number does not include the number of individual farm mink that are confirmed with SARS-CoV-2. We're tracking those by the number of farms and are aware of 417 mink farms with SARS-CoV-2 from 11 countries, including 16 affected mink farms in 4 U.S. states. The latest animal case numbers, as well as guidance for farmers and veterinarians, are available on several websites, and those links will be shared here. Also, USDA APHIS reports positive animals in the United States to the World Organization for Animal Health, or OIE. At this time, there's no evidence that animals play a significant role in spreading SARS-CoV-2 to people. Based on the limited information available to date, the risk of animals spreading COVID-19 to people is considered to be low. More studies are needed to understand if and how different animals could be affected by COVID-19, and we'll continue to keep sharing timely updates as the knowledge around COVID-19 in animals evolves. In non-COVID news, CDC has released an updated antibiotic resistance investment map, which shows CDC's work during fiscal year 2020 by state and activity. Next slide, please. Some recent publications of interest include surveillance for harmful algal bloom events and associated human and animal illnesses, which is the topic of today's second presentation. Also, the spread of multi-drug resistant Rhodococcus equi in the United States, and an analysis of recombinant proteins for Q fever diagnostics. Next slide, please. Here are a few upcoming events of interest we encourage you to check out. There are no active outbreaks other than COVID-19 currently. We encourage you to visit CDC's Healthy Pets, Healthy People website for a selected list of ongoing and past U.S. outbreaks of zoonotic diseases. Our next ZOHU call will take place on March 3rd. Please continue to email topic suggestions for future presentation and news from your organization that you'd like for us to share to zohucall@cdc.gov. I'll now turn the call back over to Laura. Thank you.
Thank you. Next slide. You may submit questions at any time using Zoom's Q&A feature. Please include the topic or presenter's name. The Q&A session will follow the final presentation if time permits. You may also email questions to today's presenters. We've included their email addresses on this slide and on the ZOHU call webpage for today's webinar, as well as in today's email newsletter. Next slide. Our first presentation, NASA and NOAA Earth Observations for Health and Air Quality Application, is by John Haynes and Julie M. Turton. Please begin when you're ready.
Well, thank you so much. And thanks so much to ZOHU and the CDC for inviting me and Julie to speak with you all today. I am John Haynes. I am Program Manager of Health and Air Quality Applications, which is part of the Applied Sciences Program Earth Science Division at NASA headquarters in Washington, D.C. And I just wanted today to give what some people would say as a brief 30,000-foot overview of our Health and Air Quality Applications program. But in NASA Earth Science, our work begins several hundred kilometers higher than that. So let's go to the next slide. For NASA Earth Science, it all begins here with our constellation of over 20 Earth science satellites and sensors in low Earth orbit, which are continuously monitoring Earth's weather, climate, and environment for research and applications purposes. This constellation represents the largest civilian Earth observing constellation in the globe, and also represents an investment of $2 billion, that's billion with a B, US dollars per year by the American taxpayer. This constellation also includes sensors that are on the continuously inhabited International Space Station as well. This constellation of Earth observing satellites would not be possible without all of our domestic and international partners that are indicated on the slide via their logos or by their international flags. Now, from this constellation of satellites, literally tens of terabytes of data on the Earth system and how it is changing are downloaded each day to ground stations across the globe and then archived at NASA's distributed active archive centers across the nation. Let's go to the next slide. And when you're talking about all of this data on the Earth system, many of these observations are critical for health and air quality applications. For example, we are able to get global observations of land temperature, of total rainfall, sea surface temperatures, aerosols, fires and thermal anomalies, just to name a few. And if we can click one more time, hopefully the slide over will come up. The great news about this is all of this data that I'm describing is free and open access to everyone in the globe, all available at earthdata.nasa.gov. Again, free to the public, researchers, and all of our partners and stakeholders. Let's go to the next slide. So certainly in the health and air quality applications program, as with all of you, our #1 priority for the past year has been the COVID-19 pandemic, and looking at how Earth observations can be utilized to help understand how the Earth system is changing in response to COVID-19 mitigation efforts, as well as how Earth observations and environmental determinants may be affecting the spread of COVID-19 itself. Now, this is an example of how NASA has used Earth observations to look at changes in air pollution due to COVID-19 mitigation and quarantine orders in megacities across the globe. For example, we're looking here at nitrogen dioxide. Nitrogen dioxide is a pollutant that's unhealthy to breathe on its own. It contributes to the formation of unhealthy levels of surface ozone, primarily comes from biomass burning, tailpipes, and smokestacks. Well, utilizing data from NASA's ozone monitoring instrument on board our AURA spacecraft and the European Space Agency's TROPOMI instrument, we've been able to show that there are large decreases in nitrogen dioxide in areas where COVID-19 mitigation measures have been introduced. These ongoing observations have helped provide immediate examples of how the Earth system is changing and responding to changes in human behavior. And of course, the example on the screen is from the megalopolis of the Northeast Corridor of the United States, showing in March 2020 the large decreases in nitrogen dioxide versus the average over the last 4 years, again due to mitigation, quarantine, lockdown efforts being put into place. We have been able, as far as if there's any silver lining to the global challenge we've been facing this past year, NASA has been able to join with the European Space Agency and the Japanese Space Agency in a sterling example of international collaboration by establishing a COVID-19 Earth observation dashboard, which not only has on that dashboard indicators of air quality and how that has changed globally over the past year, but many other indicators from Earth observations, as well as socioeconomic observations of agriculture changes, economic changes, and land cover, land use changes. Let's go to the next slide. In the Caribbean, we have partnered over the past couple of years with the University of Puerto Rico's Health Sciences Center, as well as the National Weather Service San Juan and the EPA Caribbean region, in order to develop a system to help forecast with 3 days advance warning adverse air quality events in the Eastern Caribbean, particularly those coming from Saharan dust storms. In fact, in June of this past year, the worst Saharan dust plume in 50 years impacted the Commonwealth of Puerto Rico. And through this partnership and utilizing NASA Earth observation data, such as aerosol data that you see from one of our satellites in the lower left-hand corner, the 3-day air quality warning system went in operation just a few days before the June 2020 event. Since we are partnering with the Health Sciences Center at the University of Puerto Rico, we have also been able to augment their project to work with them to look at the possible correlations between these adverse air quality events and the susceptibility of the island population to COVID-19, and for those who do contract COVID-19, the severity of their disease. And that work is ongoing. Let's go to the next slide. Julie Tratan, who will speak next, and I are proud to co-chair the GeoHealth Community of Practice. GEO is the Group on Earth Observations. It's an international consortium of over 100 member nations and non-governmental organizations who are dedicated to breaking down the barriers in the free and open access use of Earth observations for societal benefit. In the Health Community of Practice, we work to improve health decision-making at the international, regional, country, and district levels. I encourage you to visit our website, geohealthcop.org, because all are welcome to the GeoHealth Community of Practice. Since the beginning of the pandemic in March, we've been having bi-weekly teleconferences, as well as presenting at several conferences and symposiums virtually worldwide, including the American Geophysical Union Fall Meeting in December. Let's go to the next slide. As one of the projects that has been precipitated through the Community of Practice for Health, we have worked with Johns Hopkins University to take satellite observations of soil moisture, temperature, and precipitation to understand global rates of gastrointestinal illnesses. However, as many of you know, Johns Hopkins Coronavirus Research Center is one of the world leaders with their dashboard and information on understanding COVID-19 infections, deaths, and spread worldwide. So we are now working with Dr. Zajic at Johns Hopkins to investigate how similar data may be used to look at potential environmental factors that may influence COVID-19 transmission. And next slide. And I am now going to hand it off to my partner, Julie Turton of the National Oceanic and Atmospheric Administration. But for more information, not only on NASA's Health and Air Quality Applications Program, but the entire NASA Applied Sciences program, I do encourage you to investigate our website at appliedsciences.nasa.gov. Thanks so much.
Thank you, John. That was a great presentation. And can you please go on to the next slide? I also want to thank the organizers and all of you participants for being here today. It's a real honor to be able to address this group and to really try to help strengthen the connections between Earth observations and health risks. So you can see from the title here, my job at NOAA is One Health and Integrated Climate Extremes Research Lead. And I spend a lot of my time with John and others who are looking to integrate how we use Earth observation data into managing, reducing health risks. Next slide, please. So I thought I would start with a little primer, a very short one actually. This is really about NOAA's mission. So while John's starting at the kilometers above the atmosphere, NOAA has a mission that's slightly different, and ours spans weather to climate. We have oceans and fisheries, and we have some regulatory functions as well with fisheries and marine mammals. But basically our job, we're the prediction guys. So we take all that information, whether it's from a satellite or an on-the-ground observation system, and put it together with models to either predict actual changes in the climate and weather, oceans and coasts, or to predict its impact on other things such as health. We also have a mandate to conserve and manage coastal and marine resources and ecosystems. And I think many of you on the call are probably already aware of our marine animal health programs, and it's a One Health approach there. So next slide, please. So within NOAA, we have taken a One Health approach for many years now, and this just sort of codifies how we operate internally. My job, big part of my job at NOAA is to really coordinate our activities with the health community writ large, but there are many programs across the agency that really do substantial work and have, funding or capacity or expertise to do that. This bottom part with the extreme heat and drought on the left side, all the way to vector-borne disease and marine animal disease on the right, are just how we've organized ourselves in the One Health context and how we actually work within our own agency and the pieces that also work with other agencies. So next slide, please. As I mentioned, NOAA's the prediction system. We're the prediction folks. Not that other people don't do it, but a big part of our bread and butter and part of what we do both in research and operations is aiming to provide a seamless suite of forecast products from minutes to days to hours, all the way out to years and decades on multiple different climate timescales and weather timescales. And this little cone, just the light blue cone that goes around in that arc, really is meant to illustrate the levels of certainty. As you go further out, you become less and less certain, but there's variance within that. So the point is that we manage and are aiming to provide a seamless suite of forecast products on multiple timescales, and in this case, relevant for the health user. Next slide, please. So John mentioned a lot about the satellite work, and while NOAA does have satellites, we have a satellite environmental data and information service, part of our agency. So we do fly satellites as well, but we also do a lot of in situ observation systems. We do a lot of ocean observing systems. And this is not intended for you to know every dot, but just to put an example out there of how much data we collect and what we store. So we also are a data houser and data provider, not just for the US data, but also data from other countries. And we are a repository for parts of the World Meteorological Organization as well. So this is just the ocean observing example here, and it's all kinds of sensors from drifting buoys to stationary buoys to satellites to ships of convenience, and just to give you a sense of the kind of observing networks that we support and run. and what it takes to actually make a forecast. It takes a lot of observing system in the middle of the ocean to actually make a good heat forecast, which is a surprise to many people. So next slide, please. We also collect all kinds of information, climate and weather information, and we work on this model called essential climate variables, where we distill down the most essential ones and really work to curate those, maybe slightly more than others. But again, these are usually global data sets. Some are just US, but we also have a big whole division of NOAA that deals with data. And these are some of the things that they do. So my main point is to say it's both satellite and on the ground observations and in ocean observations. Next slide, please. And then next slide is exactly that, the ocean observations. I thought it was worth pointing out to this group that we actually do have an omics strategy. Not only do we observe sea surface temperature, but we're observing the microbial activity in our ocean environment as well. And I think particularly relevant to some of the talks that will be forthcoming on HABs, at least, this is particularly relevant. Next slide, please. So the point of all this is to change the area under that curve. If you look at the left side, by engaging public health decision makers, taking a One Health approach, and using all our observation and prediction system to get ahead of the curve, we want to act early and move that area under the curve that is yellow as the opportunity to reduce the health impact. Just shift it so that we have greater opportunities to act early, whether it's a couple days early or whether we can plan for months or seasons or really do like longer term planning and reduce the risk more substantially. The whole idea is to use this kind of information to get ahead of the curve. Next slide, please. So in the context of COVID, trying to make some of our data a little bit more relevant for researchers and decision makers who are trying to tackle COVID and doing modeling for COVID, we did develop a data page in conjunction with some of the disease modeling communities, with some of you at CDC and some others of you. So we would encourage you and ask you to take a look at that page. And if you have suggestions, comments, use it, find it useful, find it not useful, please help us make it better. It is designed to serve you. So let us make it better if we need to, and help us populate it the way you need it. Next slide, please. I thought I'd put a couple of examples, and I will go quickly. Each one of these could be a whole talk, but just to give you a few ideas of how this kind of information has been used or could be used. The left side is an example of Rift Valley fever in Eastern Africa. And the point here is that we basically at NOAA do an El Nino forecast among many of our forecast products. But there was a lot of research that happened and said, we understand that with an El Nino, there's a certain rainfall and drought combination that is a predictor for Rift Valley fever. So that was probably 20 years worth of research. But when the El Nino in 2015 came, we were able to put all that together with guidance for, okay, here's an El Nino, here's what we think is going to happen, and here's what to do about it. And while that doesn't sound like all that much, it actually was a pretty big deal to get all that together at the right time and try to get it out early so that donor countries, the host countries at CDC, people could take action early and not be scrambling so much. I won't spend a whole lot of time on the one on the right. It's a dengue forecasting challenge, just to say that we've also been kind of upfront trying to figure out the science with CDC and other agencies as well. So, and we would very much continue to look forward to continuing to do those kinds of activities with this community. Next slide, please. And I wanted, this slide, again, it could be a whole talk in and of itself, but the point here is that we aren't necessarily trying to predict disease outbreak on, June 22nd of this year, but we are really looking in many cases at the environmental factors that are suitable for a particular outbreak or a particular disease risk or a particular health risk in general. And so looking at the science to understand what we can predict with what strength, and can we go all the way to disease outcome, or is it enough to start at just the environmental drivers and the environmental risks? So those are questions I wanted to, hopefully we'll have time to talk about. Next slide. And these are just a few examples of some of the products that we actually already have. We are working very closely with folks from CDC and FDA and some of the state and local health organizations as well to manage Vibrios, which are, I'm sure most of you know, bacteria in the ocean environment. And in the US, it causes illness from shellfish consumption or wound infections. It also, more globally, is the same species that causes cholera, similar species anyway. And it reacts largely to sea surface temperature, among other drivers. So we were able to do the forecast in the middle there is a longer term historical forecast. The ones on Alaska are really a risk projection of where Vibrio could occur based on sea surface temperature. So the point is, they're different scales of time at which we can work, and different geographic scales at which we can work. And then we're going to hear a little bit more about harmful algal blooms next. So I won't go into that, except to say that we do have a pretty robust program in predicting harmful algal bloom risks with our health partners in some coastal locations around the United States. Next slide, please. And the last piece I want to say before I just close out here is that, I do run a big effort on heat, National Integrated Heat Health Information System. And I only wanted to raise that heat affects so many of these things that we're talking about: drought, coastal runoff, water quality. So while you may not be concerned, you may be concerned about heat in urban environments or just straight heat, the heat impacts on whatever disease or system or health impact you're studying is an exacerbating factor, or can be. And we know that we're going to have increasing amounts of heat and changes in our distribution of heat and heat wave events. So just keep that in mind. And if you're interested in that, check out the NIHIS portal. You can see it there. And at the end, I believe I've got the website listed as well. This is truly an interagency effort here, and it is picking up steam again in this new administration. So stay tuned. And if you're interested, reach out to us on heat. Okay, next slide. Thank you. So this is one of my favorite quotes, and I love the fact that we have almost 500 participants here. Clearly, you are interested in thinking and doing things differently, and I would just encourage us all to do that. We can't get where we want to go by thinking the way we have been before. So thank you to the organizers for this, and to all of you for listening. Please do reach out to me if you have any questions, or put them in the Q&A at the end, and I look forward to working and hearing from some of you later. Thank you very much.
Thank you. Next slide, please. Our next presentation, Surveillance for Harmful Algal Bloom Events and Associated Human and Animal Illnesses, One Health Harmful Algal Bloom System, United States, 2016 to 2018, is by Virginia A. Roberts. Please begin when you're ready.
Great, thank you so much. It's a pleasure to be here today to talk with everyone about a piece of our work at CDC related to harmful algal blooms. It won't cover everything, but it should give you a taste of some of our recent efforts related to surveillance. First, next slide. First, I'd like to thank my co-authors on a report that we'll discuss today. They're here on the left in italics, but also the many local, state, and federal partners who we continue to work with. They're too numerous to list here, but they're all very essential to this effort. Next slide. So recognizing that not everyone may be familiar with this topic, just a kind of a brief description. When we talk about harmful algal blooms, we're talking about a couple of different things. So macroalgae, which are more commonly known as seaweed, and phytoplankton, which is a group of small plant-like organisms, can grow rapidly or bloom and may cause harm to people, animals, the local ecology, or the local economy. These are what we and kind of a larger group generally refer to as harmful algal blooms, or HABs, and they're supported by factors such as warm water and nutrients in the water. Public health concerns, however, primarily focus in on two types of phytoplankton and the toxins that they can produce. That's cyanobacteria, which you might have heard called blue-green algae, and microalgae, which produces things such as the red tides that you may hear about on the Gulf Coast. Typically, we see cyanobacterial blooms in freshwater settings and microalgal blooms in marine or brackish water settings. And HABs do occur in fresh and marine waters throughout the United States. Next. So people and animals are primarily exposed to HABs and their toxins through skin contact, inhalation, and ingestion. These could be from swimming or other recreational water activities, breathing in water droplets that contain toxins, or using contaminated tap water. Seafood can bioaccumulate and pass on HAB toxins when eaten, and dietary supplements and foods that contain algae can become contaminated. Treatment is primarily supportive care to alleviate symptoms for most of these conditions. Next slide. But animals can have unique risks for exposure. Some of this can relate to their physiology, but animals may also behave differently than people, going into water that we'd avoid, drinking it, or eating decaying algae near the water. Some aquatic animals live in the water where the HAB is occurring, and animal illnesses may serve as early indicators of a HAB or its severity, and also provide information about the risks and health impacts of HABs. Next slide. So I just want to encourage you to check out CDC's HAB-associated illnesses website to learn more about HAB exposures and illnesses and what you can do to protect yourself and loved ones from harmful algal blooms. Next slide. And just so you're aware that we do have some information broken out for specific groups as shown here. So for example, animal owners, veterinarians, healthcare providers, and poison control center professionals. And we're hoping to expand upon this as we go forward in time and make it more robust. Next slide. So the next section will just provide some brief background on public health surveillance through the One Health Harmful Algal Bloom System, or OHABs. Next. So OHABs launched in 2016 and is nationally available to state and territorial public health agencies, which can designate user accounts to their environmental and animal health partners. So that's someone like their Department of Environmental Quality. It allows for systematic data collection about HAB events, human cases of illness, and animal cases of illness. Reporting to the system is voluntary, but both in general adoption of the system and for its components. So for example, one state might report HAB events while another might report human cases of illness. OHABs does not replace routine water monitoring or real-time investigation tools or event response systems. Next. Reporters to the system review the available environmental, epidemiologic, and clinical data and use OHABs definitions to classify HAB events and associated human and animal cases. These definitions consider current scientific understanding, and they'll benefit from refinement over time. Challenges to investigating and classifying cases include limited access to diagnostic testing for human and animals, and sometimes to timely and routine environmental testing for the HAB events themselves. When the information is available, a challenge can be to interpret those findings as they relate to health effects, just based on what we know about some of those exposures and the relation to the health effects. Next slide. An investigation and reporting may depend on the HAB event case setting and jurisdiction, as well as who or what type of animal can be affected. In the examples shown here, people who become ill after a trip to a lake may contact their poison control center, their health department, or even a medical provider. Cases reported indirectly or directly to the health department are interviewed, and the health department works with its partners, such as its Department of Environmental Quality or Agriculture, to collect and review other supporting evidence before entering data into OHABs. Of course, partners for animal case surveillance may differ, especially in the detection and investigation of illnesses. Next. So what types of public health questions can OHABs help to answer? The introduction of systematic data collection of HAB for HAB-related events and illnesses on a national scale can help us to do things like understand the frequency and distribution of HAB illnesses, HAB-associated illnesses, including trends, better characterize these illnesses in terms of clinical presentation and related to the toxins involved, understand the risk factors for exposure and illness, and inform our illness prevention efforts. And really where we want to go with all of the work we're doing around public health and surveillance is really thinking about how do we mitigate and ultimately prevent those illnesses. Next. So if you'd like to learn more, and you can see the forms and technical guidance for OHABs on the OHAB section of our website that's linked to the bottom of this slide. Thank you. Next slide. So now I'd like to share some initial findings from our first 2 years of data reported to OHABs and published in a recent MMWR weekly report. Next. There were 18 states that we refer to as the early adopters of OHABs. These early reporters entered 421 HAB events, 389 cases of human illness, and 413 cases of animal illness occurring from 2016 through 2018. Although no people died, 369 animal deaths were reported. Next. Of the 421 HAB events that were reported, 25% included information about human or animal case reports, if not both. These cases were reported by 13 states. All human cases were reported individually. However, groups of animals such as fish, herds, or flocks of birds could be reported in aggregate. And this option was used in 9 instances, accounting for 86% approximately of the reported animal cases. So one of the points about the system is that we can collect information in aggregate about animals, and that can greatly reduce the burden for reporting. It does make analysis a bit more complicated and sometimes less granular on the other end, but we really try to find that balance so that we can have successful One Health reporting. Next slide. HAB events and cases of illness occurred most frequently in warmer weather months, with HAB events and human cases peaking in July. Overall, 90% of reported HAB events were freshwater cyanobacterial blooms. The proportion of human and animal illness related to such blooms were similar to this. A large multi-month HAB event was responsible for 51% of all human cases, or 199 human cases. A HAB event at a lake in May was associated with a single bird die-off of 300 individuals and accounted for 73% of animal cases. Next slide. 88% of OHAB's reports included environmental testing results. The most common reason for conducting this testing that was reported was routine monitoring. So water quality monitoring programs can lead to early detection and notifications to the public. We also saw that citizen complaints and human health or animal health event response were also important contributors. I will note that reporters could select multiple options when reporting, and not all of those options are shown here. Next slide. So as shown on the left, toxins were the most frequently reported environmental lab result. Within these results, microcystins, a cyanobacterial toxin, were reported for 94% of HAB events. The U.S. Environmental Protection Agency has reviewed available data and released risk-based guidance for two toxins, including microcystins, to assist with management of drinking water systems and recreational bodies of water. Next slide. Among human cases, at least 39% were less than 18 years old, indicating the importance of prevention efforts targeting youth and their caretakers. Among cases who experienced a single exposure, people became ill within a minute or up to 8 days. In general, healthcare seeking behavior was limited, except for contact with poison control centers. And this was driven heavily by the multi-month HAB event that was mentioned earlier, in which cases were detected by and reported through a collaboration between the state and the poison control center in that state. Although clinical testing isn't widely available, 8% of cases did have some testing done to identify or rule out a cause of illness. And CDC tested 5 people and confirmed exposure to foodborne toxins in 4. Overall, 22 cases of foodborne illness were reported in this 2-year time period. Next slide. There were 52 domestic pets, 42 livestock, and 319 wildlife cases of illness reported. Within these categories, the most frequently affected animals were dogs at 96%, cattle at 86%, and birds at 97%. For the 21 animals with a one-time exposure, illness onset ranged from 15 minutes to 4 days. Veterinary medical care or treatment was only provided to 66% or 25 animals. But it's important to also consider here that the total number of reported cases includes those 300 wildlife cases that were part of a large mass mortality event. Next slide. So regarding signs and symptoms, gastrointestinal or generalized categories were the most frequently reported. However, multiple others were also noted. Generalized refers to constitutional symptoms such as headache, fever, or lethargy. These data highlight some of the challenges with detection of HAB-associated illnesses, particularly those associated with freshwater blooms. Signs and symptoms may not be specific enough on their own to identify the causal agent, absent other information to either confirm a HAB exposure or to rule out other likely causes. And not as well characterized here is the severity of signs or symptoms. For example, rapid onset of severe symptoms in dogs or other animals can easily be fatal. Next slide. Looking at confirmation and classification, most HAB events were classified as confirmed, human illnesses as probable, and animal illnesses as suspected based on the state's review of the supporting evidence upon submission to OHABs. I'll note that the HAB events that were entered are only classified as suspect or confirmed, so there would be no probable classification there. Fewer than 5% of human or animal cases of illness were classified as confirmed based on the current OHABs criteria. And just calling out that requires supporting evidence such as a medical diagnosis or clinical confirmation of a HAB exposure. Since diagnostic tests, again, are not readily available, it will be of interest to see how classification of future cases might shift as availability changes. Next slide. So kind of coming back and kind of as we start to summarize and wind down this presentation, what does all this mean? So when we look at the summary of the OHABs data from 2016 through 2018, it represents the launch of national public health surveillance for HAB events and associated illnesses in the US. It's a high-level summary of what's been reported, but it's a landmark step forward in better understanding the impact of HABs on human and animal health. The time period represents data from 18 states and tells us a cohesive story about the relationship between these events and the human and animal cases. So we find that very encouraging for this early report out of this One Health system. When we look to the future, we see that a continued One Health approach to surveillance alongside scientific developments in the field and increased access to specimen testing, these will improve the system as a whole. Next slide. And we're planning to increase the use and access to OHABs data, including more routine and timely releases of annual data summaries. We're also continuously focusing on efforts that will support adoption and reduce reporting burden. We want to strengthen and expand the partnerships, the One Health partnerships that are so critical to all the steps in surveillance, from detection through reporting and use of the data for illness prevention. Next slide. So as I close, I'd like to invite you to check out our health promotion resources on our website, including the updated physician and veterinary reference cards for cyanobacterial blooms. These references will also soon be available in Spanish on our website. Next slide. And then we also have a pet safety poster. Print versions are available to order free from CDC. Please take a look at all of our resources and don't hesitate to provide feedback on what else would be useful. Next. And I'd just like, again, to thank you for your time. And when we get to the end, if there's a chance, I'll be happy to receive any questions. Thank you.
Thank you. Next slide, please. Our final presentation, Exploration of Decontamination Strategies for Odor Detection Canines, is by Dr. Karen Meidenbauer. Please begin when you're ready.
Thanks so much. Good afternoon, everyone. My name is Carrie Meidenbauer, and I work at the Johns Hopkins Applied Physics Laboratory. It's my privilege to get to talk with you today about some recent research that we've been conducting on best practices for routine decontamination of odor detection canines. Next slide, please. This work originated in the beginning of the pandemic, actually. So we have been working in the odor detection canine space for just over a decade and have developed expertise along the lines of training aids as well as operational enhancement to enhance the specificity of these canines as well as their operational utility. So some of our stakeholders within this space reached out and said at the beginning of the pandemic that they had received guidance from their agencies that, you know, when they completed a shift and they returned home, they were supposed to take their clothes off in the laundry room, put it immediately in the washer, remove their shoes outside, and enter the house. However, their canine partners were entering their homes with them and immediately going and sitting on the couch and hanging out with their kids. And they noticed the disconnect here that, you know, how come I am asked to remove my clothes at the door, but my canine partner is going immediately into my home and interacting with my family when I'm asked to go and shower before touching or talking with anyone. And so, as a true One Health issue, they've noted this and reached out for help to ask, what should we be doing with our canines at the end of a shift? And what does successful decontamination look like in a routine setting? And when we received that request, we did a lot of initial preliminary literature research and found that there really isn't a lot of material in this space in regard to routine canine decontamination from potentially biological risks. So in regard to the SARS-CoV-2 pandemic, I do want to mention that, of course, as the CDC notes, there is a very low risk of us interacting or getting SARS-CoV-2 infection or exposure from our canines or from our pets. However, we really are underprepared when we're looking at the decontamination space for any biological threats. So this research is relevant not only to the operational canines for the current pandemic, but also as we look forward for being ready for any future threats as well. In addition to the canine decontamination work, we are also doing a second study. It is to identify unique signature profiles. And this study is essentially to better understand what does COVID smell like? So in order to use canines to detect respiratory infectious disease signatures or to use any other sort of sensor, we need to better understand what is the VOC or volatile organic compound that is produced by individuals who are infected. And so we're exploring this space by a longitudinal study as long as a tissue culture surrogate study. And we look forward to hopefully being able to share that work with you and present on it in a future presentation. But just to make you aware, there's a lot of research going on within the SARS-CoV-2 space at Johns Hopkins and at the Applied Physics Lab. So I'm excited to share this piece of that work portfolio with you today. Next slide. So as I mentioned, the problem itself is that we know our operational canines are frequently working in potentially contaminated environments. And so we were looking for best practices or to determine what is the most effective way to minimize this risk for both our canines and their handlers. We needed not only to develop best practices, but also to figure out, how can we get this material off of not only the dog themselves, but also their equipment. And if we could figure out a way to sort of develop a protocol or approach that could knock out two birds with one stone, meaning that if we could find a wipe or a method that could not only decon the dog, but also their equipment in the field, that was going to be the optimal solution. So with that mindset, we set off to accomplish three tasks. First was a preliminary pathogen removal study. Second was a pathogen neutralization study. So how do we remove the potential contaminant, and then how do we inactivate or neutralize the potential contaminant on those surface of all of these different coupons. And then last but not least was to take the results from those two studies and to develop a routine, fieldable canine pathogen decontamination protocol recommendation. Next slide. So first we wanted to get a sample of what are the typical operational equipment that our handlers and canines are using in the field, and then what would create a good laboratory surrogate for fur. And so the most commonly used reward toys by our canine handlers are bumpers, which are a plastic material, tennis balls, which of course are that cloth porous material surface, and then rubber Kongs. So it gives us three unique surfaces to play with to figure out what is the best way to universally decontaminate all three. In addition, our canines are also all equipped with usually a harness, a leash, and a collar. Now, these are tricky surfaces as well because they're all porous. The leash is often leather. The harness is usually a mill-spun webbing kind of material with Velcro and some nylon. And then the collar is often nylon with metal and also some Velcro on it as well. So really tricky surfaces to effectively decontaminate. And then last but not least is of course the exploration of the fur itself. We did use coyote pelts as a surrogate in the laboratory, recognizing that there is some differences between live fur and a potential pelt surrogate. But really the challenge with this study was just looking at how do we remove superficial contaminant from that porous fur surface. Next slide. In addition to the removal component, we also explored the cleanser space, and this was on our task 2 neutralization study. So In our selection, we chose to go with a wipe-based approach. This is based on a broad spectrum of research that proves in our soldiers that personal use of wipes to decontaminate is one of the most effective readiness strategies for rapid deployable, fieldable decontamination. So this was the approach we chose to pursue. With those wipes, we wanted to select cleansers that we knew would be effective against a broad spectrum of potential pathogens that our partners would encounter in the field, and also that were proven to be safe to be used on canines. So that is how we down selected to these individual cleansers. Now, from this list, we did do a preliminary proof of concept study and actually down selected further. So after that initial study, we actually eliminated povidone iodine, which is betadine, from our study, as well as hydrogen peroxide. Reason being is the povidone iodine itself, when we were using it within the context of the removal study, actually left even diluted fourfold, a very sticky brownish residue on the surfaces. In addition, it didn't effectively remove versus mask the contaminant that we were using in that study. So we found that our handlers mentioned if the dog felt stickier or dirtier after the cleansing procedure, it probably would not be effectively adopted. So therefore that specific cleanser was removed. Additionally, the hydrogen peroxide was removed because of some concerns for safety. Even though it is labeled that it is safe to be used in limited quantities superficially on canines, we felt that it was not performing any better than the other cleansers included that are proven to be safer, so it was also eliminated. So based on that, next slide, please. We began our removal study. The approach to this study was to test all of those various coupon surfaces. To do that, we contaminated them with a fluorescent pathogen tracer. In this case, it was glow germ. This methodology is commonly used for decontamination studies, so it was proven. Fur and equipment were evaluated for that residual fluorescent pathogen tracer post-decontamination, and we did do replicates of each type, both the fur and equipment for this study. The reason there were additional replicates for the fur itself was due to the fact that there was some variation in texture and coloring, and we wanted to ensure we were getting a comprehensive spectrum of those variations to make sure they weren't impacting our results. Photos were taken of these coupons prior to contamination, after contamination, and post-decontamination, and 2 image analysts analyze these images separately, so blinded, to make sure that we were getting honest results. Across those images, across the replicates, that's how we determined the success of each type of cleanser, and we're able to draw our conclusions. The good news for us is that preliminary results from the removal study prove that regardless of the type of cleanser using, wiping was an extremely effective methodology to remove superficial contaminant. And thus far, that hasn't been proven on a fur surface or on canine equipment specifically. So this was very promising results to receive. We had over 80% efficacy on even the water and baby wipes, and over 90% across all of our cleansers. So very promising that this is a good potential risk mitigation strategy for wiping as a fieldable decon solution. Next slide, please. For our neutralization and inactivation study approach, we actually exposed our coupons to a live viral surrogate for SARS-CoV-2 at a threshold similar to what canines may encounter in an operational environment. So in this case, it was to mimic a human cough or sneeze. Now, of course, most people that are in the environments that these dogs would potentially be working are wearing masks, which is great. However, this is very relevant to future use because eventually we do see that these mask mandates will go away. And as I mentioned, this is also a readiness thing to assure that we have a protocol in place that could be used for potential future risks. So with this, we did down select even further for the neutralization study based on the results from the removal study. We maintained the water and baby wipes as our controls, or non-cleanser controls, and then we down selected to IPA, or the isopropyl alcohol, and our chlorhexidine solution. The Nolvason scrub, which is also a chlorhexidine scrub, was down selected. It was efficacious, but also left a residue due to the detergent in it. So due to the fact that it did not perform better than the chlorhexidine solution, it was removed from the study, and we focused purely on the chlorhexidine solution. Surrogus virus was then applied to these coupons and dried. The virus contaminated coupon was then wiped with the cleanser wipe, and the residual virus was pulled off of the coupon and run on TCID 50s to determine how much viable virus was remaining. Results allowed for viral viability to be assessed after each decontamination. Again, results from this, we're still analyzing some of our final results from this study, but very promising. We were able to prove that wipes are extremely effective, again, at neutralizing in addition to removing superficial contaminant, and got very little residual virus off of many of the coupons, even with the cleansers that are the non-active cleansers being the baby wipes and water wipes. The more challenging surface, of course, are the porous ones. One of the biggest challenges was actually the leather, due to the fact that it absorbs so much of the solution applied. And so it was very challenging to get any virus back off of it, which is interesting. So the stickier surfaces tend to be more challenging to remove virus, but also, you could think of that twofold, that potentially there's a lower risk of transferring virus due to the fact that if we couldn't get it off in a laboratory controlled setting, the likelihood of it transmitting as a fomite surface is probably lower. Next slide. So to summarize kind of what we've done and give you guys some fuel if you're interested in learning more, we did complete the pathogen removal study. That manuscript is being finalized, so I'm excited to announce that hopefully that will be published in the near future, and I will be able to share it with you soon. Additionally, we are finalizing our pathogen neutralization study. Right now, we are doing a secondary synthetic fur study as well to just really get to the root of some of the challenges with that porous fur surface to understand the best approach to clean it via wipes. That study and publication is expected to be shared in the spring of 21. So hopefully soon we'll have that out to you all as a resource too. We have developed an initial protocol for routine pathogen decontamination recommendations that is being shared with DHS to utilize and share with their partners. Again, it'll need to be tailored per agency and the risk associated. And all of this work is relevant, again, to operational canines. So not recommended for pets, but for operational canines and their unique threats in the working environment. So with that, my next slide is my last. I wanted to take a moment to acknowledge my team. I work with some incredibly talented, very dedicated scientists who worked extremely hard throughout some challenging moments during the pandemic to get this study done. So I wanted to acknowledge my team, and I also wanted to acknowledge the Department of Homeland Security, Science and Technology for sponsoring this work. So I look forward to answering some questions, and thanks so much for your time today and the opportunity to present.
Thank you, and thanks to all of today's speakers for their informative presentations. We do have time for just a few questions. Please use the Q&A feature in Zoom to send your questions and include the presenter's name or topic if you have not already. So I will start out with a question for Dr. Meinbauer. Was UV light considered as a means to decon as well?
Hello. Yes, it was considered initially during this. However, there was some considerations and concerns in regard to safety, concerns for safety for our handlers, as well as the canine's exposure to UV light and the safety of that. In addition, it was a challenging technology to field. And so the goal of this approach and the options that we were exploring were something that an officer could potentially throw in the back of their trunk, pull out at the end of the shift, and decon the dog prior to getting in the car. And we were unable to figure out a way to successfully utilize UV technology safely in that manner.
Thank you. We have a question about OHABs, wondering if it's available to U.S. tribal governments.
That's a really great question. At this time, we haven't worked out all of the permissions, relationships pieces from a technical standpoint, how to properly open that up to tribal entities, but it's an area I'm really interested in considering and pursuing how we can do that well. So I'd be happy to discuss any other questions or thoughts that people might have about that following the call.
Okay, thank you. And another question on harmful algal blooms. Is there more risk to the public during an active harmful algal bloom outbreak or in the fall when the algal cells break down and release their contents?
I think that that's a really good question. It's a complicated question because one of these is looking at some of the immediate risks and one of them is kind of looking at potentially at some of those kind of extended risks. I think generally speaking, our best advice on this is, when in doubt, stay out and stay away from a hab, and keep your pets away from them. And I think that there's still further research that needs to be done to do that kind of comparison by types of blooms and type of exposures.
Thank you. And this is a question for Dr. Turton. Are you tracking other insect-borne diseases than dengue, such as Chagas disease or leishmaniasis?
Thank you for that question. So let me just clarify, we aren't actually tracking diseases per se. We're working with scientists who either have data or working with health professionals, and we provide the environmental information. But the answer is yes, we are working on other diseases, have funded work on leishmaniasis and other climate-sensitive vector-borne infectious diseases. So yes, but we don't actually track the disease per se outright. We rely on those of you on the CDC and health side to do that.
Thank you. And then one more question for Dr. Meinbauer. How do you think the practical application of your findings will be communicated? Meaning, would anybody in a COVID positive household need to wipe down their dog daily for 14 days?
Great question. So as of right now, this research was focused specifically on the risks unique to operational working canines and not explored for pet dogs or in that setting. So I can't answer that fully since our research was not focused on that population. As far as conveying our findings and the protocol that we did develop, that will come through DHS S&T. So again, I can't comment specifically on how it'll be delivered right now, but I am hopeful that it will be shared with the greater community soon.
Thank you. And since we're at 3 o'clock, we will stop with the questions for now. If you have other questions for today's presenters, we've included their email addresses on this slide, as well as on the ZOHU call webpage for today's webinar and in today's email newsletter. And a reminder, a video of today's webinar will be posted within 30 days. Please join us for the next ZOHU call on March 3rd, 2021, and thank you for your participation. This ends today's webinar.